Remember the scenario at the beginning of the course? If you need a refresher, you can read it in the Know More section. Let's consider how a traditional multidisciplinary healthcare scenario could be improved by using an interprofessional collaborative practice approach that we've been learning about. Before office hours, the healthcare team gathers for a 10-minute huddle. Dr. Mann, a family physician, Julie, the medical assistant, Andrea, the nurse coordinator, and Mandy, the social worker, review the patients for the day and the administrative aspects of the healthcare team. Dr. Mann notices that a young woman named Kara is going to be seen with a chief complaint of a potential STI and a request for a pregnancy test. The team identifies that Kara will need to be screened for healthy sexual health behaviors and encouraged to seek prenatal care if pregnant. The team then assigns roles. Julie will take a patient history and run both the STI and pregnancy tests after taking vitals. Dr. Mann will pre-order the tests and the electronic health records so Julie can run them when Kara arrives. Dr. Mann and Julie will indicate to Andrea if the patient needs a brief intervention for alcohol use and prenatal education. Mandy will be brought in if there are concerns that Kara will need more than a brief intervention, including referrals to more intensive treatment or any concerns in covering the costs of her health care. By pre-planning patient visits, clinicians can be proactive in a patient's care, ensuring that the patient gets what is needed at the correct time. When clinicians work together, they help patients avoid unnecessary appointments and see the appropriate healthcare professionals for their needs. These proactive approaches save patients time and resources and provide opportunities to reduce costs to health systems. The team breaks, and Julie goes to get Kara from the waiting room, where the receptionist has checked her in for her 8 a.m. appointment. Julie welcomes Kara and brings her back to the patient room. Julie asks Kara about her chief concerns, and Kara requests testing to learn if she has an STI and if she is pregnant. The medical assistant takes a short history, asking Kara a series of questions about her sexual history. Kara reveals that her most recent partner told her he has chlamydia and also reports unprotected sex with 3 partners over the last several months. When asked about health habits, Kara reports drinking on average 10 drinks per week, mostly on the weekend. Julie records Kara's concerns and health history in her electronic health record and also notes in the chart that Kara will need a brief intervention for her alcohol use, as was discussed in the healthcare team meeting. Julie then asks Kara if she has any questions. Kara reports being nervous about her tests, and Julie tells her that it's normal to feel nervous and reminds her that the results are confidential. She then proceeds with administering the STI and the pregnancy tests. Julie then leaves the room to get the physician. Because of the healthcare team meeting, Julie was able to bring up the intervention early in the visit. She also saved time by conducting the STI and pregnancy tests before the doctor's visit. Julie informs Dr. Mann of Kara's health information, vitals status, and that the tests have been run. Dr. Mann looks at the patient profile in the electronic health records and tells Julie that she agrees that a brief intervention can be conducted by Andrea, the nurse, related to Kara's alcohol use. With test results pending, issues related to healthy pregnancy, contraceptive use, and STI prevention should also be addressed. Dr. Mann asks if Julie feels additional services should be offered by Mandy, the social worker, and Julie says that Andrea should decide during the brief intervention. During the patient's visit, the healthcare team further collaborates to agree on next steps for Kara. Dr. Mann develops a plan of action and assigns roles to both the nurse and social worker. Dr. Mann examines Kara and summarizes the behavioral health information shared in the earlier exchange between Kara and Julie. Dr. Mann says she is concerned about Kara's alcohol use on the weekends and her sexual behavior. Dr. Mann asks Kara if she would be open to talking with a nurse about these, and Kara agrees. Dr. Mann tells Kara that she or a member of her staff will call Kara when the test results are available, thanks Kara for coming in, and tells her that Andrea will talk with her further. Andrea performs the brief intervention, and they discuss goals related to Kara's behaviors that can improve her overall health. These goals are written on a pamphlet describing contraception, which Kara will begin using if the pregnancy test is negative, and are documented in the electronic health record for Kara's next visit to the office. Andrea decides that Kara responded positively to the brief intervention and does not need additional social worker assistance at this time. She informs Kara that she will ask Julie to make her a follow-up appointment. Because of the health team's earlier communications, Andrea was ready to provide the intervention as soon as Dr. Mann was finished. Andrea also documents their discussion and Kara's goals to be referred to during the next visit. Social work assistance was available if needed. Julie makes Kara's follow-up appointment and asks Kara if she has any questions. Kara tells her the information from Andrea was very helpful, but she is concerned about the cost of contraceptives if she isn't pregnant, and prenatal care if she is pregnant. Julie provides Kara with information on the local federally qualified health center where she can get low-cost or free medical care and contraception. Kara thanked her for this information. Julie will update the team during their end-of-day debrief. Kara has agreed to additional help from the healthcare team at the next visit. This coordinated effort proved to be an efficient and effective way to help a patient begin thinking about healthier behaviors, including preventing an alcohol-exposed pregnancy. We encourage you to think about how you can incorporate the interprofessional collaborative approach into your practice or work. You should now be able to define interprofessional collaborative practice, describe why healthcare is moving towards interprofessional collaborative practice, and describe strategies for building an interprofessional collaborative practice team for the prevention of alcohol-exposed pregnancies. Thank you for taking the Interprofessional Collaborative Practice as a Model for Prevention of Alcohol-Exposed Pregnancies course. Provided as part of the Collaborative for Alcohol-Free Pregnancy, Partnering for Practice Change.